Hello, Memorial family. And this week, we saw a significant decline in the number of COVID-positive patients in our facilities. This represents a 29% decline from 3 weeks ago. That's very encouraging. However, we're not seeing a similar decline in the number of ICU patients, and at the same time, we're seeing our mortality rate increase. On a positive note, we have seen an increase in the number of employees taking advantage of our vaccination incentives. We're up to almost 72% of all of our employees been vaccinated. Please take advantage of it. We're running out of time. If you remember, our deadline is October 1st. And let's hear more from Dr. Mark Knapp.
Hello, it's good to be back with you again. I'm really thrilled to be able to talk about the progress that we're making in COVID-19. Our numbers of hospitalized patients is coming down, and that's exactly what we've been hoping for. But while the numbers of hospitalized patients is going down, the number of patients that are requiring intensive care unit care continues to increase. And the number of patients requiring ventilator support, can't breathe on their own because their lungs are too injured, is also going up. Along with that means that mortalities are going up. Almost all of these deaths and almost all of these hospitalizations were entirely preventable. And for those of you who've been vaccinated, we really applaud you for making that decision. For those of you who haven't been vaccinated, it certainly isn't too late. There's other news regarding the pandemic, and that has to do with hospitalizations of children. It's not entirely clear if it's because school is opened again or there's something different about this version of the virus, but we are seeing more children hospitalized at Joe DiMaggio Children's Hospital. And this concerns us, something that we keep our eye on. Now, we don't know what's going to happen as the school year continues to unfold. If we are not vigilant about vaccination and wearing masks and protecting ourselves and the people around us, we are going to spread the virus. As I look at my calendar on my desk, I notice that, gee, it's September. What does that mean? It's flu season. And so while we've been hammering on everybody to get their COVID vaccine, it's also time to get your flu vaccine. Now, we require flu vaccination for all our staff. By the way, you can actually get the COVID vaccine and the flu vaccine at the same time if you want, if you haven't been vaccinated yet. So if you got the Moderna or the Pfizer vaccine the first time around and you are somebody at risk because of a weak immune system, those vaccines are approved for a third dose. I'm incredibly proud of our organization, and our organization is really nothing more than a collection of the 14,000 people, including you, who work here every day to do what needs to be done for our community, taking care of people who need us desperately at their worst situation. So thank you, thank you, thank you.
We all know that it's been a very long journey. We're almost 19 months into this pandemic. You know, the staff is so resilient. You're on the front lines, and we recognize that is very stressful. So please take advantage of all of our services that are available to you. Let's hear more from Dr. Sotelo.
My name is Jorge Luis Sotelo. I'm the Medical Director of Psychiatry at Memorial Regional Hospital, and I'm here to share some thoughts about the toll that the COVID pandemic has taken on us as healthcare providers. It is important to keep in mind that even though it's been very difficult to work under these circumstances, that it is important to maintain a certain level of hope and resilience. Some of the things that can be implemented are remaining connected socially with people that are important to us. Sometimes it's easy to become more isolated whenever we are tasked with significant stressors. So it would be important to continue to remain connected to those whom we value because they may be able to provide a significant amount of help and remind us that we're not alone. Another important component is that of wellness, practicing wellness and taking care of our bodies. So making sure that we're getting an adequate amount of sleep, that we're eating a good and healthy diet, that we are hydrating appropriately. Memorial Healthcare System believes in taking care of its own. It has partnered with BetterHelp, which is a subscription service that provides access to online counseling. By contacting the Employee Assistance Program through their 1-800 number, our employees can be connected with the BetterHelp resources as well as in-person counseling. In addition, there are many applications that can be downloaded to our smart devices that can help us with wellness and meditation. Overall, we just want you to maintain a sense of hope and to remain active and vigilant about whatever symptoms you may be having, and to reach for help if you feel that your battery is running low.
As you're all aware, Haiti experienced a devastating earthquake about 3 weeks ago. We as an organization are supportive of any relief efforts that we can do to aid that country. We're committed to matching up to $5,000 of anything that is raised by the employees, physicians, and anyone who wants to contribute to that campaign. This week, we're very excited because we started the demolition of the property that will house the Memorial Cancer Institute outpatient building. It truly is a state-of-the-art facility. As you can see, we're making a lot of progress. We're grateful for all your work, and thank you for everything you do.